Asma is not her real name, but her pain is. A survivor of rape, she is inconsolable.
I cried for help after 2 of the attackers threatened and later gagged me with a piece of cloth. They forced me into a room.
She says they raped her repeatedly because she refused to disclose the whereabouts of her husband, an activist. This wasn't the first time Asma was assaulted. In 2022, before her wedding, she tells us, she was also raped. She says she couldn't tell anyone then, not even her family, for fear of rejection.
I went to the hospital but couldn't bring myself to tell the nurses I was raped.
Healthcare workers say there are hundreds of unreported cases of sexual violence among the women and children arriving in eastern Chad after escaping the violence in Sudan.
Doctors say most cases of rape are not reported because of fear of stigma. Pregnancies resulting from such attacks are rarely terminated because of cultural and religious beliefs. The victims are often left to deal with the trauma and stigma alone.
Social worker Habib Abdurrahman admits a major crisis is unfolding, as many survivors of sexual violence have been rejected by their families.
If we could get help, the victim's recovery process could begin, but at the moment there's nothing to work with. When you go to the hospitals, there aren't even enough beds for emergency cases.
Hospitals and aid agencies are focused on providing food to more than 400,000 refugees and treating the critically ill. Rape cases aren't a priority right now, which means survivors of sexual violence like Asma must find ways to bear their grief and pain in silence. Ahmed Idris, Jazeera, Adre, on the Chad-Sudan border.
Now, the situation on the ground is such that there are no medical facilities, no consultants, no social workers to help these victims to deal with the problems. Now, these problems are continuing to mount. You're talking about more than 1 million refugees from West Darfur alone who've thousands of them have gone through this process. Some of them have been attacked repeatedly. 600,000 from earlier conflicts in Darfur. Like for example, this lady we've spoken to who is still married, she's been attacked even last year. And there are several of such cases here. Doctors are confused as to what to do with these ones. When we go to the hospitals, they say when they go to the hospitals for consultation and for help, they really cannot be helped simply because there isn't enough facility. And doctors are more worried with more critical issues like saving lives, like people bleeding to death or children hanging in for dear life. Cyril?
Yeah, Ahmed Idris reporting from Adre in Chad. Thank you so much for that reporting.